Dr. I Am Jumpy has ordered a sliding scale for insulin for our patient Skip Rocker. So I'm going to go ahead and administrate that. The first thing I want to do is check my patient's 6 rights. So right patient, right medication, right dose, right time, right route, and then of course right documentation. And I will want to first check the physician's orders, which his order is, again, a sliding scale, and the patient's glucose was 230. So we're going to administer 10 units. I want to check my vial, and I want to make sure there's no cracks in my vial. I want to, if this is a multi-use vial, I want to put the date, the time, my initials onto it. It should be good for 30 days after being opened. I'm going to clean the top with an alcohol swab. And we're going to use a 100 unit syringe, insulin syringe here. And we'll take I also want to stress the importance of washing your hands before getting the medication ready and before administering the medication. So, of course, before I would start all this, I would have washed my hands too. So I'm going to go ahead and take the cap off, and we're going to insert it here into the vial. Ooh, first, I want to pull the air back so I can insert the air into the vial. And again, we're going to go to 10 units. Excuse me. And we'll go ahead and put it in the vial, insert the air into the vial. And then we're going to go pull the syringe back to 10 units, making sure to get out any air bubbles. Checking 10 units. All right, so then we'll go ahead and we'll put the cap back on the needle, and we don't always want to recap our needles unless we're taking the medication to the patient, and you don't want to transfer an uncapped needle from the med room to the patient's room, or if the sharps container is across the room, then we would want to recap our needle. I want to verify this medication with another nurse, and she'll have to sign off that she verified the medication. And then before going into the patient room, I want to make sure that I have my syringe, another alcohol swab, and my gloves. All right, so going into the patient room, knock, 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 hello, Skip Rocker. I want to identify the patient with 2 identifications, checking the patient's name and date of birth and the wristband. I also want to check the allergies, and this patient is allergic to Celebrex, so I want to make sure before even pulling this medication that the patient won't have a reaction to the medication because of known allergies. I want to wash my hands and apply gloves, and I want to pick the right site. And there's several sites that I could do this from. I could do it from the back of the arm right here, or the abdomen, or the iliac crest. And for the sake of this video, I'm going to do the abdomen. And you want to make sure that doing this, you're 2 inches from the belly button. And so with my non-dominant, well, first I'm going to clean the site with an alcohol swab, starting in a circular rotation, working my way out. With my non-dominant hand, I want to pinch the skin, and I'll let this dry before I administer my medication. So I'll pinch the skin, and I'll go in at a 90-degree angle, and I want to hold it, and I want to administrate it slowly into the skin. And so then I will just pull it straight out. I want to dispose of my needle and my syringe into a sharps container. I then want to blot any area with a gauze to remove any blood. I don't want to rub or massage this area. And then I want to make sure that when I'm all done with this, I document the medication, the dose, and the location that I put the medication into.